So what do you do about it if you're caught in the pleasure trap, if you're an addict and you're addicted to the artificial stimulation of dopamine in your brain, whether it comes from drinking alcohol, smoking cigarettes, snorting cocaine, or eating chemicals added to your food? Is there a way out? Yeah, it turns out there is. Today, fasting has become more popular, talked about, particularly intermittent fasting or limited feeding, where you narrow your feeding window. We certainly encourage that. We practice that at True North Health, where you have breakfast, you have lunch, you have dinner, but that period of feeding might be 8 or 10 hours a day, so that you have 14 or 16 hours of fasting every single night. And just that period of deprivation every night, cumulatively, is thought to induce some of the changes that we're going to be talking about today with another type of intervention called long-term water-only fasting. The advantage to intermittent fasting is you can do it yourself safely. You don't have to modulate your medications. You don't need a doctor in order to be able to guide you through that. Long-term water fasting is a disadvantage because it does need to be in a controlled setting. But that's what we do at the True North Health Center, and that's what I want to talk to you today a little bit about. The fasting I'm talking about is the complete abstinence of all substances except pure water in an environment of complete rest. Unfortunately, it turns out that that rest is an important component. As we'll learn, when you go on a fast, you eventually deplete your glycogen or your sugar stores. And if you continue fasting, you will either burn primarily fat or you'll burn a combination of fat and protein, depending on how active you are. If you continue to force the body to produce and utilize glucose by being too active mentally or physically, where that source is going to come from ultimately turns out to be protein. Whereas when people rest, they're able to derive primarily their fuel from fat. In order to determine who's a good candidate for fasting, there's a few things that need to be done. A history exam and laboratory evaluation, actually really important, because one, you want to rule out the people that are not good candidates for fasting, and number two, you have baseline data, so during fasting you can tell the difference between a good thing and a bad thing. Sometimes the good things and bad things look alike. The body generates an acute response as it attempts to heal itself, and to tell the difference between that's a good healing crisis and that's a problem developing, it often helps to have reliable data to fall back on, including physical exam and blood testing. Some things that we don't fast for would include if you're pregnant or you're lactating. If you're lactating, you could fast, but you'll lose your milk production. Not a good thing for you or your baby. If you're pregnant, we avoid fasting for obvious reasons. Conditions like anorexia nervosa, a neurological condition, make poor candidates for fasting. Type 1 diabetics don't make insulin. Insulin is an important component in being able to fast. So although 95% of diabetics are type 2, they may do well fasting. Type 1 diabetics typically will not fast. If you've had a recent stroke, MI, pulmonary embolism, or DVT, fasting is not absolute protection against these problems. You'd be at increased risk, maybe even in part because of the physiological dehydration that occurs in fasting and other issues. Cardiac instability, atrial fibrillation, severe kidney disease, porphyria, deficiency, depletion, cachexia, or MCID. MCID is medium chain acetyl coenzyme A dehydrogenase deficiency. And that's a genetic defect where you don't break down fatty acids, so you wouldn't be a good candidate for fasting because you would start vomiting and die, and it would be really bad for our outcome data. So we test everybody and make sure that they don't have that very rare condition. It's about 1 in 10,000 people. If you can't get off your medications, there's a big problem because medications are often potentiated during fasting. And so you have to first go through the process of weaning medications. If you just arbitrarily discontinue many medications, that can be a very serious or life-threatening problem. Not getting off medications and trying to fast can also be complicated. So with patients with medications, the first step is appropriately withdrawing their medications. But remember, most people are not medicated for their condition. Most people are medicated for their diet. And the day you change your diet is the day that your need for medication begins to start to change. And most patients are able to be successfully weaned off medication in a controlled setting. And as I mentioned, the inability to obtain adequate rest would be a contraindication for fasting. So conditions favorable to fasting obviously include diseases caused by dietary excess. If your disease is caused by dietary excess, it's not shocking to find out that fasting helps undo the diseases of dietary excess. So obesity, conditions like cardiovascular disease, particularly high blood pressure, as we'll learn, type 2 diabetes, autoimmune disorders. Remember what autoimmune disorders are. They're your body attacking yourself. That's what causes the joint changes in rheumatoid arthritis. It's your immune system. Your immune system becomes confused, as we'll talk about later, and attacks itself. And it turns out fasting is very helpful at helping get the body to stop attacking itself. The traditional way of treating autoimmune disease is to shut down the immune system with powerful drugs like prednisone or methotrexate. The problem is, at first, that's like a dream, because your pain goes away. And then it becomes a nightmare, because it turns out you need your immune system. And when you shut the immune system down with these powerful drugs, the long-term consequences are devastating, sometimes even worse than the condition that you're trying to treat. Some types of cancer, like lymphoma, GI disturbances and impact on the microbiome. We believe that we're going to, research that we're doing right now is investigating the effect of the fasting on the microbiome, the 1,000 strains of bacteria that live in the gut, and also how those gut bacteria behave. You know, it's what they're pooing in you. You want your gut bacteria pooing fertilizer into you, not toxic waste like TMA, which is going to become TMAO as it's processed in the liver. And so we believe that fasting may be helpful in rebooting the mechanisms, much like taking a computer with a corrupted hard drive. You know, you turn it off, you turn it on, a lot of stuff sorts out, you don't know exactly why. We're trying to figure out that why right now. And obviously, dependence and toxicity. Sometimes people are cigarette smokers and they have trouble quitting, but in fasting, most patients within just a few days report no withdrawal cravings. Those cravings go away very rapidly in fasting. Now, some people say, yeah, they're so miserable fasting, they don't think about cigarettes. But it actually is because the whole metabolic cascade of withdrawal is just greatly facilitated during fasting. Fasting ranges from 5 to 40 days. So I tell my patients that are needing to do really long fasts, especially these 30, 40-day fasts, that Moses, David, Elijah, and Jesus fasted for as long as 40 days, so they're in good company. And no, we don't teach people how to part the Red Sea. But if we did, it would be in the wrist action. Average fast at the True North Health Center is 1 to 3 weeks. And some patients require multiple fasts. Unfortunately, at this point, we don't have the type of non-invasive diagnostic testing that allows us to predict how long a person is going to fast in order to reach clinical satisfaction. And that's why we have a really flexible policy. People can book however long or short they want. There's no penalty for getting done early. So we tend to overbook stays, and then they can adapt to whatever actually turns out to be the need. I'm going to give you an example of a case report. This particular patient was a 42-year-old female diagnosed with follicular lymphoma, which is a type of lymph cancer. It was stage 3 because you could feel large tumors, both upper and lower extremity. You can see the sizes of the lesions that were demonstrated by CT scan. She'd undergone what's called a guided core biopsy, a surgical excisional biopsy, confirming the diagnosis. Her flow cytometry is listed there as well. So this patient went to her family doctor, and the reason she had been tracked for 2 years is because the treatment for lymphoma is not shown to extend lifespan, has a lot of side effects. They often will delay treatment until there's really, kind of where it's much farther along. So her doctor had monitored her for 2 years. It continued to progress, and finally he told her that it was time to see the oncologist, that she needed to undergo chemotherapy, radiation, whatever. And she asked the doctor, what about dietary change? And he assured her that diet didn't matter. It didn't matter what she ate. She could eat whatever she wanted. Diet didn't have a relationship to this condition. She asked her doctor, what about alternative therapies, including fasting? And her doctor told her that fasting was criminal quackery. So when she went to the oncologist confirmed that it was time to start chemotherapy. She asked the oncologist about diet, and he told her that he didn't think diet would make any difference, that she could eat whatever she wanted. She just had to eat plenty of nutritious foods. And he asked her about fasting. He said he didn't know anything about fasting. And so given that tremendous medical support, she decided to come to the True North Health Center, where she underwent 21 days of water-only fasting, during which time her tumors disappeared. She had 10 days of refeeding when she was sent back to the oncologist at the medical school with some coaching. And the coaching was about how to manipulate her doctor into making sure he did a follow-up CT scan. So she went back to the doctor, and he examined her a couple times, checked her chart, checked the picture on the chart, checked her picture, and asked her what happened. And she said she went to the criminal quacks and she did the fasting, and the tumors all went away. And he said, oh, well, that's interesting. I'll have to give them a call. And then she said she'd like to get a follow-up CT scan to objectify the changes that had occurred. And he was a little bit nervous, and he said that she didn't need any CT scans because she was better now. And she said, but she'd really like to have a CT scan. And what if there's some cancer lurking just beneath the surface? And then he said, okay, fine. Ordered the CT scan. Now, during this fast of 21 days, she lost 22 pounds, which is about typical, about a pound a day is average weight loss during fasting. So she went from 174 to 152. She resolved her tumors, and at 2-month follow-up, she was 139 pounds. Now, how did she go from 152 to 139 pounds after fasting? She's back eating. What's she eating? A whole plant food, SOS-free diet. And I explained to her if she didn't stick to the diet, it could be deadly because I would track her down and kill her. So she followed the program. We know she followed the program because she told us, and also we could see the results. She maintained her weight, but she was still neutropenic. And that means her white count was still a little bit too low. Her doctor actually had suggested perhaps they could do some gentle chemotherapy. And she suggested that maybe they wouldn't do any chemotherapy, that she'd like to see what would happen with following the program, which she did, and by 6 months, her white count had normalized. At a year, we decided, okay, this was very good, she's done well, she's maintained these results, it's time to write up a case report. And so I called my colleague, Dr. John McDougall, and I said, hey, I've got this interesting case report on lymphoma resolving with fasting, and he said, but do you have objective data? I said, yeah, we've got the follow-up CTs, and he goes, oh, okay. Well, maybe you should try submitting. I said, I think I'd like to submit it to the British Medical Journal. And he said, no. He said that don't submit it there. They're not going to publish it. You got to go to a smaller impact journal. So given his wise and sage experience, I, of course, immediately submitted it to the British Medical Journal. And fortunately, after a little bit of back and forth, we were able to get it published. This was about 3 years ago. But before it came out, they asked us why the oncologist hadn't signed on to the case. So I wrote to the oncologist and I said, Doctor, thank you so much for all the support you showed in referring your patient to True North Health Center for medically supervised fasting. And as I'm sure you expected and have witnessed, your patient's gone into full remission. And now we're so looking forward to working with you in the years to come and tracking her long-term success. And since our paper's been accepted for review at the British Medical Journal, we'd like you to sign on as co-author of the study. Yeah, he didn't get back to me on that one. Yeah. So then what we did was they invited us to track this person long-term because they said, look, a certain percentage, a very small percentage, but a certain percentage of lymphoma patients will go into spontaneous remission. Maybe it wasn't just the intervention, even though, yeah, it's progressed for 2 years, it resolves in 21 days, but, still could be chance. But why don't you do a long-term follow-up? Because even in patients that spontaneously remit, they usually don't maintain long-term success. So we continued to track this patient for 3 years, and during which time, fortunately, she was compliant with a whole plant food SOS-free diet. And then we brought the patient back in, before I get to that, I'll show you this. These are the before and after CT scans of the first fast. You can see the large masses. You don't need to be a radiologist to see these changes. That was the paper. If you go onto our website, healthpromoting.com, you can find all of the information on the True North Health Center. We also there's a new website out called fasting.org. And fasting.org is a fasting compendium site with all of the research on fasting, including this paper that you can read, Water-Only Fasting and Exclusively Plant Foods Diet in the Management of Stage 3 Low-Grade Follicular Lymphoma. At 3-year follow-up, she was 136 pounds, maintained her weight loss, and she had a full-body CT that showed no lymphoma. So after this CT was done showing she was completely free of cancer, what we did was we did a follow-up fast of another 3 weeks, and she continues to be cancer-free to this day. We submitted this paper on invitation to the British Medical Journal, follow-up of this patient, and it was rejected initially. 2 reviewers, one reviewer said, ooh, interesting follow-up, great, recommended publication. The other said, she's probably just lucky, not worth publishing, and recommended rejection. Fortunately, on appeal, the editor overrode, that opinion, and they did publish this just recently in 2018 in the British Medical Journal Case Reports.